Hi everyone, my name is Lulu Achua. I am gonna be providing cleaning and irrigating a wound and applying clean dressing on the wound. I'm sorry I do not have an actual patient or a stuffed animal, so I'm gonna be walking you through the steps of which it takes. Again, I am sorry this video is coming late, past due, because I had a cold and my voice was gone. You can actually hear that I'm still struggling to get my voice back. So I start. Before any procedure, before working with any patient, the first thing to do is to verify the order. So in this case, I'll verify the wound care order. And after that is done, I make sure I provide privacy to my patient and hand hygiene, which is very important. I introduce myself to my patient and then I gather my equipment, all the supplies that are needed for the irrigation and a fresh dressing change. Sorry. And after gathering my equipment, I have to then do the two-step identifier. So in this process, I identify the patient by asking them to tell me their first and last name and their date of birth. While they do that, I verify with their armband. I make sure I provide appropriate positioning for my patient. And while I'm doing that, I also maintain dignity and limit exposure. I place a pad underneath of where the dressing is supposed to be done, underneath the wound, so that the pad collects any residue. I have to first of all start by removing the soiled dressing, the old soiled dressing. I have to put on a pair of clean gloves before starting any procedure. I soften or loosen the edges of the old dressing by placing a hand on the side of the wound and using the other one to pull off the tape gently in the opposite direction. The hand that I'm putting on helps to apply a little pressure and helps to keep the skin intact. If there is a need to moisten the dressing if it is too sticky, because sometimes the adhesive tape becomes so sticky on the body and it's a little bit difficult to take off the tape. If that need arises, I have to moisten the old dressing with normal saline, the 0.9% normal saline before removing it. That helps to soften it, to let it come out easily. I dispose of the soiled dressing in a biohazard bag. Then I remove my gloves, perform hand hygiene, and I don a correct set of PPE, and also prepare a clean field where I have to use, which I have to use to do my irrigation and dressing. I irrigate the wound with a normal saline and then using my dominant hand, I use moistened sterile gauze to clean the wound as if need be, and then I make sure I change of the gauze or the parts that I use. Changing the gauze every stroke. I change the gauze. I do not repeat the gauze in another side of the wound. One stroke, one gauze. I dab the wound bed with dry sterile gauze, and I make sure while I'm dressing the wound, I'm assessing the wound at the same time, making sure that checking for progress, if the wound is healing or anything new has occurred, any difference in the location, the size, the presence of drain and odor. Check if success is being done, like the wound is healed, is been healing. When that is done, the wound is being taken care of, I remove all soiled gloves and wash my hands. Then I put on a pair of clean gloves and then apply a dry gauze on the wound. I apply a second layer of gauze over the wound site. I make sure I apply surgical pad over the gauze, and I make sure, very important, not to forget to label the dressing with my initial and the date that the dressing was done and time. Then I remove my PPE and dispose of the supply. I wash my hand again. Then I reposition the patient to a comfortable position. Then after that is done, documentation is the key. I document the wound assessment, I document the dressing change, I document how the patient tolerated the procedure, and all anything that I find during the dressing will be documented appropriately. That's it. Thank you.